Maing adlaw na tong tanan. If you have a neurological disease such as a stroke, spinal cord injury, or traumatic brain injury, and your leg is flimsy, flaccid, or difficult to move, then this video might help you. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. After you have a neurological disease, usually the first thing that will happen is that your leg becomes flaccid, flimsy, difficult to move. Sometimes you don't even feel any sensation to it. In this video, we will try to wake up that flaccid leg and try to make it move again in order to re-educate the muscle and the nerve connections. We will be using fast tapping or fast brushing or even vibration to wake up that leg. Whichever technique you prefer to use, the concept is the same. And we will be using things that you can find at home, such as a spatula for cooking, a hairbrush, or anything that vibrates really fast, preferably a massage gun. But if you don't have this, just use the other methods. The concept is still the same. You will start proximal muscles, but the facilitation would be from distal to proximal, okay? In this video, we will be laying on our bed because it will be easier to access certain areas if you are laying on your bed. So let's lay on our bed. You will also use a pillow as well. So in this video, I'll be using a spatula to do the fast tapping, okay? So the first area we need to facilitate is our buttocks muscles or our glutes, okay? So let's pretend, so that you can just see easier, let's pretend that my stroke leg is my right leg, okay? So I'm going to lay on my side, put the pillow in between your legs, and since it is my right side, I can use my right arm, right? So I am going to use my left hand or left arm to tap your glute muscles. So just tap, 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 tap for 30 seconds, and then after that, try to slide your leg downwards here, okay? So the muscles that are responsible to bring your leg back, especially when you are walking, is your glutes and some of your hamstrings, okay? So we will be starting with the glutes. Tap, tap, tap for 30 seconds, and then slide your leg downwards. So the pillow will help you elevate your leg and let gravity assist in moving that leg. It is preferred too that you wear pants because it will be hard for you to bring that leg up again to try another movement, right? So you just grab your pants and then slide that leg again. Now, if you cannot move that leg one more time, do the fast tapping again or rest, okay? So the number of repetitions is not the goal here. The goal is to wake up certain muscles that are asleep, essentially, and move it, okay? So again, bring that leg up using your good hand to pull it up, and then actively try your best to slide that leg downwards, okay? The next area that we need to facilitate is the muscles responsible in bending this leg back like this, right? So again, I'm going to bring that leg up using my pants. If you have a belt, you can also use the belt to pull that leg up. You're going to tap your hamstring muscles for 30 seconds. So from distal going up to your buttocks. After 30 seconds, try to bend that leg, okay? Use gravity and the pillow to help you move that leg with gravity, okay? So again, you're going to bring that leg up and then tap your hamstring muscles. After 30 seconds, try to move that leg again. Okay? Bending that leg from the knee. Okay? We don't have to facilitate the calf muscles, which is responsible in bringing your toes down like that, because usually when you have a neurological disease or your leg is flaccid, that toe will naturally, your foot will naturally point down, okay, because it is weak. So we don't need to facilitate that muscle for now. All right, so the next area we need to facilitate will be our front part, the front part of our leg. So let me turn. All right, and this time I want you to pretend like my stroke leg is my left leg. Okay, so since my left arm is affected by stroke too, most probably, or is also flaccid, I'm going to use my good arm. Okay, it is still better if somebody will help you do the tapping, but if you don't have anybody or they're at work, do your own home exercises. Okay, so the first area from the front part will be from closest to the hip. Okay, so the muscles responsible for hip flexion, like this. So bringing your hip up or your knee up, like that. Okay, so we are just going to tap the muscle closest to the hip. Okay, just like so. All right, and then after 30 seconds, position your pillow where your leg can come up and slide down easy. Okay, so do your best to contract that muscle to bring your knee down together with gravity. It should be easier for you to do that. If no muscle contraction, that is still okay. Be patient. Okay, so do your tapping for 30 seconds and then move your leg down. Okay, bring your knee down towards the edge of your bed or towards the bed. Okay, next area is the muscle responsible for knee extension, to bring your knee or your leg straight. Okay, so what you want to do is again tap for 30 seconds closest to the knee and up to your hip. Okay, you might see my left arm moving, but I'm just avoiding those areas that are too noisy. All right, so tap, 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 tap for 30 seconds and try to extend that knee, okay, or straighten that leg. Sliding that leg down, okay? So try to contract the muscles here, the fleshy muscle here from the front part of your thigh, okay? So just like that. And again, 30 seconds of tapping and move it again, okay? Next area to facilitate will be this part right here. Please avoid the bony prominence there or your tibia, all right? You don't want to be hitting that because that will hurt. So you're just tapping the fleshy part to the side of your leg, your lower leg, okay? Close to the calf muscle. So there is a fleshy muscle there. So tap again, going up for 30 seconds. If you have a brush, you just go this way, all right? Or if you use a massage gun, turn it on and massage going up, okay? Use the fast vibration, the fastest setting. So again, for this video, we will be using the tapping method using your spatula. Use whichever one you want. Then after tapping your anterior tibialis muscle, you try to bring your toe and your toes and your foot up, okay, like this, but try to use gravity again to slide that leg or that foot upwards like that, okay? So move, you can move it back up and then try again like this. Alright? Push it. And try to move again. And then if it's tired, you can rest. So tap, 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 tap for 30 seconds. And then try to move your ankle, your foot, and your toes downwards with gravity. Okay, always use gravity, especially if your leg is still flaccid, very weak, and sometimes unable to move yet. Okay? Alright, so those are the techniques that I suggest that you do at home in between sessions with your therapy in a clinic or when you have home health in between visits. Please be consistent, do your exercises at home. Do not wait for somebody to help you. You can help yourself if you want to get better quick, okay? So do the tapping, do the fast brushing, or do the massage gun, whichever one is available and whichever one works. You will see a difference. Everybody is not the same, okay? So use one that works for you. And if you have any questions, suggestions, and comments, just type it down below in the comment section, and I will try my best to reply and give suggestions and answer your questions, okay? So again, a reminder, consistency is the key, and never give up. Until next time, paalam!